King 5 News.
Tonight, a closer look at the effects of recreational marijuana. Public health officials in Colorado say since legalization, they've seen more pregnant women using the drug to fight nausea, depression, and other symptoms.
But those officials have a strong warning. They say THC, the psychoactive drug in marijuana, can harm an unborn child.
John Ferrugia from our sister station in Denver partnered with Rocky Mountain PBS to investigate a Colorado study on how much THC is in the breast milk of nursing mothers.
Good job.
Jamie Leone loves being a mom, but it hasn't been easy.
It was a tough pregnancy.
Jamie has battled depression all her life, and after giving birth at age 20, she became suicidal.
I would even have thoughts that maybe like if I was gone, my kid would be okay because my mom could raise him.
It was Jamie's husband who first suggested she try cannabis edibles to treat her depression.
He just told me, just take a few and tell me how you feel.
Since then, Jamie has been consuming edibles several times a week.
I feel like I have more patience with him. I'm able to be interactive with him because I'm a very quiet person.
But the concern is Jamie is still using cannabis while breastfeeding.
I think that it is perceived as being a medication or a drug that is very safe, it's very organic, and I think what we just don't know are the ill effects of that.
Dr. Erica Wymore, a neonatologist at Children's Hospital in Colorado, is leading the state's first pilot study on how long THC stays in breast milk of mothers who consume cannabis.
When it is consumed into your body, it gets stored in your fat stores. And our brain and our nervous system has a lot of fat content, as well as breast milk has high fat content. So that's where our primary concern is, what are the effects on the baby's developing brain? The body of evidence does point to problems with cognitive development, as well as behavioral problems later in childhood and in adolescence.
In Wymore's study, nursing mothers agree to discontinue cannabis consumption for a period of 6 weeks. That has already caused several to drop out.
About half of them said that they couldn't stop using marijuana. And it signals to me that we have a public health issue if women are thinking that it's better to use marijuana and take that risk and that gamble.
And she is not alone in her concern. In 2014, Tri-County Health, the state's largest county health department, quantified the number of mothers in its Women, Infants, and Children program who self-reported using THC. Of 1,749 women surveyed, 95 admitted to THC use in the previous 30 days. Among that group, almost 36% reported using while pregnant, about 41% after pregnancy, and nearly 14% while breastfeeding. What's more, a national study published recently by the Journal of American Medical Association shows that the use of marijuana among pregnant women has increased more than 60% since 2002. The Colorado Department of Public Health and Environment has issued guidelines for pregnant and nursing mothers warning there is no known safe amount of marijuana use during pregnancy. But Jamie doesn't see it that way because she says definitive research has not been completed.
If there's something out there like a research that shows that it's bad for either me or my baby, I would stop. But there's nothing out there. I think it's doing me good, so.
What I just hope is that people would have more caution to let us try to find more evidence to support what the exact effects are and be a little bit more patient before using something that could harm your child.
And that was John Ferrugia reporting. Washington law does not require hospitals to test newborns for THC. If they do test and it comes back positive, hospitals are only encouraged to report the family to the state. They're only required to report it if they suspect abuse.
And get this, starting tomorrow, a new warning label is required on all packages of pot-infused products. The logo must be on all food and drinks with marijuana. And here's what it looks like. Take a good look. Pot processors must either put the warning label into the packaging or put a sticker with the label on their products.